Welcome to the Future Pulse podcast, where we dive into the world of innovation and technology. My name is Malika, and I'm the founder and CEO of Skill Torch, which is an AI tech recruitment company operating across the globe. Today, I have with me who is heading up the UK for Convene. So, absolute pleasure to have you on here.
Hi, Malika. Thanks so much for having me on your podcast.
Tell the audience a bit more about yourself and what you do.
Sure. So I'm the general manager for a large business called Convene Group. So we've got about 1,300 clients. And what we do is that we automate manual administration within healthcare and other sectors. Yeah, it's been a very busy Q4.
That's a good thing, hopefully.
Yeah, hopefully, yeah.
Yeah. Well, tell me a bit more about what made you explore AI in healthcare, because you previously had a background out tech as well, didn't you?
Yeah, so I think I've been using AI in my professional personal life for some years now, and I see AI as not just about short-term efficiency gains, but it's also about genuinely transforming how care is delivered or even administered. I think AI and healthcare is possibly one of the most exciting combinations out there.
Yeah, no, definitely. And what sort of biggest AI trends are you seeing right now in the UK healthcare space?
So I think we're seeing a huge amount around um, sort of automating manual administration. So a really good example would be around AI clinical scribes. So businesses like Tandem, for example, or Nabla or Heidi Health. I think they're really transforming patient engagement, and they're also helping to reduce burnout and improve efficiency for clinicians. So I really love that. And I also love organizations that are using AI to deliver more precise diagnostics as well.
Right. Okay. Why is sort of the AI adoption accelerating? Like yeah, where is that? And then sort of do you think that's affecting workforce shortages? Obviously, everyone's complaining about the NHS and the staff shortage around that, and even just the administrative burden, or is there more to it than just these things?
I think you're right to say that you have these more immediate pressures which leaders are thinking about on a month to month basis. So for shortages, for example, the drive to reduce waiting lists, the drive to try and increase the amount of appointments which are attended by patients and so on. So that's been a huge driver, certainly for AI. But I think what's really exciting when you look at more visionary leaders is actually AI can be an effective solution to solve those challenges. But I genuinely think it already is transforming how healthcare is delivered, not just in the UK, but other countries as well.
Okay. And then just kind of going back to the AI scribes, how does that actually work in practice?
So with an AI scribe, the way that the patient journey would work is that if we use a GP example, the patient
Hmm.
would arrive at the treatment room within a surgery. The clinician will ask for their permission to be recorded by an AI scribe service. So, for example, Tandem Health or Heidi.
Hmm.
And then that's typically an app on someone's device, for example, or it can be a dedicated listening device. The clinician and the patient then have their typical conversation. So the clinician will try to diagnose the issues, what could be causing them, trying to understand the correct next steps, whether that could be referrals, whether that should be additional tests, for example. And then what the AI scribe does is that it uses speech recognition technology
Okay.
to translate the verbal discussion into a written script. And then I think where the real magic happens is then the AI pulling out relevant insights from that conversation, such as what were the key issues discussed, what were the key next steps discussed, whether that's a referral or medication, for example. And I think when you look at different studies, I think it's really powerful. When I go back to what I was saying earlier about transforming how care is delivered, before AI scribes, typically when you go to a GP, especially in the NHS, they are very time pressured. They've
Right.
got less than 15 minutes to complete everything, look up your records, diagnose you, type up your records, and finalize the next steps. So what that means is, generally speaking, at the moment, around 70% of that clinical time is the GP looking at a computer.
Yeah.
Whilst with an AI scribe, when you look at various studies, that's been reduced from 70% to less than 20%. So patients feel seen, they feel more understood, they feel a greater sense of engagement. And I think that's really important because good healthcare isn't just clearly having a very well qualified clinician is critical, but if you can also that help improve that bedside manner, I think that's super important as well. And I think the other thing which is exciting when talking about transforming healthcare is with AI, healthcare systems can go from being reactive to being more proactive and more personalized. Because with various AI tools, you're able to diagnose or identify patients who might over index in terms of being at risk for certain conditions, and then being able to then provide them a personalized care plan as well. So I think this idea of going from unpersonalized and reactive to being more personalized and proactive healthcare, I think is really powerful.
Right. Okay. And then, so yeah, I suppose because I went to the surgery the other day and there was a tablet. I put in my information, my date of birth, and then my name, but I still think I'm not seeing the AI that should be in there. I still think things are still outdated. Maybe it's just my surgery. I don't know, but I still think here it's still quite early on, isn't it?
Yes, I think it's still a minority of GP surgeries at the moment. But I think that's going to soon change. So it sounds like at your particular surgery, when you actually after you checked in and when you went into the treatment room to be seen by your GP, it sounds like that your surgery isn't currently using an AI scribe tool.
No, doesn't seem like it.
Yeah, you would know for sure because because the operating model for that is that the patient is always asked upfront, we are a clinic that uses AI scribe technology. Would you like this to be used in your consultation, or would you prefer for that not to be used?
Yeah.
So hopefully, hopefully you don't have to visit the surgery anytime soon, but hopefully the next time you are there, they've adopted technology to deliver even better care.
Yeah. I mean, do you think AI is going to replace any sort of human element of care? Or does it sort of mainly enable clinicians to just sort of be a bit more human? Because I
I
think
think
that's what
it's
would scare people.
I think it's very much the latter. I don't think AI is going to replace human clinicians. I think it simply enhances their ability to deliver great care. And
Mm,
it does it not just by being able to simply analyze a huge amount of data very, very quickly. It's so much more than that. It's about reducing the stress for the clinicians as well. Because a big part of the stress, so typically in a healthcare system, up to one third of a clinician's time is spent on administrative tasks. So with
right.
AI, if you can bring that admin burden down, because clinicians choose to become clinicians because they want to help people, not necessarily because they love admin. So any solution, whether it's AI or not, but certainly AI
Mm,
is accelerating that. It helps to reduce a clinician burnout, helps them deliver better treatment and do it with a much better bedside manner, is great for the clinician, and is also fantastic for the patient. And then just to touch upon the sort of replacement of human clinicians, it's certainly not going to do that. It's certainly going to enhance them. And actually, a lot of global healthcare systems, I find that there's actually a shortage of clinicians as well, because a lot of clinicians are retiring or they're looking to work part time, for example. But at the same time, demands on healthcare systems are increasing because we've got a more elderly population. And we also have a population that's more aware of their health needs as well. So a lot of healthcare systems are being asked to do more with less. So I think AI is going to be really helpful to meet that challenge.
right. Okay. And then when we spoke earlier on this week, you mentioned the staggering amount of emails an NHS sends out. It was like, what, 10 million, I think? I
That's
mean,
right, 10
how can
million a
AI make
month.
a dent in that? That's mad. I mean, how can AI make a dent in that?
So I think and there's a very good piece of research that's put out by Microsoft because they did a huge trial. So they did a trial with around 30,000 NHS colleagues across 90 NHS organizations. And so they found out by that AI can help automate the more menial tasks that everyone has to do as part of their day job. And so I think they found that they're able to save clinicians and other NHS workers around 40 minutes per day, which is great. So even
Mm,
simple things like, so I think this study talked about Microsoft Copilot, for example, being able to summarize emails, draft emails, for example, suggest next steps, which is great because, you're not just saying 40 minutes per day, but, in any sort of office job, there's a lot of context switching as well. So, and that can be mentally draining as well. So I think even something as mundane as summarizing your email, drafting emails, so you can spend your time and your energy doing something that's more higher value, doing something that's of higher impact, I think is superb.
exciting. I mean, I suppose if you could send one message to healthcare leaders about AI, what would it be?
So I think in the UK, we have an incredible UK health tech startup scene. It's really vibrant, and that's because we've got some of the best universities in the world. We've got a very creative and entrepreneurial culture. And I think often we will see in the NHS that a lot of contracts and opportunities still, I would say, still over indexed towards much larger organizations. And that's because a large organization like the NHS naturally is thinking about, well, I need a good, stable supplier. But if you don't give startups that opportunity, you're not enabling those small and medium-sized businesses become the large businesses of the future. And a
Mm,
long-term NHS contract can provide that stability for that startup to grow, to invest in R&D, and to make sure that some of the best innovation stays in the UK, with not just um, the design and the creation of the innovation, but also delivering it in our home markets as well. So a lot of great UK health tech startups find that they cannot sustain themselves without overseas contracts. So I
mm.
think that's a real shame because that's not easy to do. So it would be amazing for more UK health tech leaders to try and provide pathways for small and medium-sized UK health tech businesses to work with them.
Right. Well, thank you so much for joining me on the podcast, Sebastian. It's actually been a really insightful conversation about how healthcare is going to change in the UK.
Yeah, well, no, it's been an absolute pleasure, Malik. I've known you for a long time. It's been an absolute pleasure to be part of your podcast. So thank you so much for the invitation.
No worries.